Hi everyone, my name is Lauren Adu and my topic for the Capstone project was in what ways has COVID-19 changed our healthcare system and the implementation of new HIM policies and procedures. Some objectives I have included for the presentation are define the new implementation since the pandemic, explain how COVID has impacted the traditional HIM workflow, explain how these changes affected HIM professionals both physically and mentally, define the new policies and procedures in place since the pandemic, explain how our healthcare industry has evolved since COVID, explain why HIM professionals were essential for data collection during the pandemic, explain how data collected by HIM professionals contributed to healthcare facilities being able to maintain COVID outbreaks, and define the data tools and resources used to collect information throughout the pandemic. My research question for the capstone topic was in what ways has HIM contributed to the data collection for COVID 19 initiatives, and how did this impact the traditional HIM workflow? So, a little bit of an introduction. In 2020, the COVID 19 pandemic struck the US, leaving the country on lockdown for several months. The World Health Organization declared the coronavirus outbreak a global pandemic. COVID 19 has become the fifth documented pandemic within the US since the 1918 flu. HIM was one of the very few careers that still had an opportunity to work throughout the pandemic. In fact, the US became dependent on healthcare professionals such as HIM to battle and overcome COVID 19. So that leaves us with my initial research question. In what ways has HIM contributed to the data collection for COVID 19 initiatives, and how did this impact the traditional HIM workflow? Some background information. Healthcare professionals were challenged by having to work in a totally different context and environment. This included exhaustion due to heavy workloads and protective gear, the fear of becoming infected and infecting others, feeling powerless to handle patient conditions while also managing relationships throughout this stressful situation. This put extreme stress on healthcare workers throughout the U.S., leading to workforce shortages as well as an increased healthcare worker burnout, exhaustion, trauma, and negative effects on their physical and mental health. The impact of COVID 19 on healthcare. Since the pandemic, there have been many changes within the healthcare industry. COVID 19 disrupted many healthcare professionals in regards to facility changes, remote work, and shifting priorities. Healthcare professionals were expected to remain up to date with these changes, including facility closures, suspended services, increased communications, virtual education, emergency room visits decreased by 40%, increased use of telemedicine, shortage of staff members, and a shortage of protective equipment to treat COVID positive patients. The pandemic not only affected professionals at work, but their home life as well. Many individuals found themselves battling with issues related to mental health and social wellness. Throughout this time, professionals experienced a great deal of anxiety, stress, and frustration. Throughout the pandemic, public health officials gathered data from healthcare organizations for case reporting, as well as studying the best practices for addressing the virus. HIM professionals were essential throughout this process as they are expected to inform organizations on the best practices and are responsible for case reporting. HIM professionals. Health information management professionals are responsible for organizing, overseeing, analyzing, and protecting patient information. They ensure that the data being collected is accurate and accessible. These professionals serve as a link between physicians, patients, and third-party payers. HIM professionals collect patient information in regards to their diagnosis, symptoms, medications, procedures, test results, previous medical history, lab orders, nurses' notes, and physician orders. These professionals monitor the quality and accuracy of patient documentation while also working collaboratively with other healthcare professionals to ensure this information remains confidential and protected. HIM professionals' role during COVID 19. So, case reporting was one of the biggest resources used by healthcare professionals throughout the pandemic. HIM professionals played an essential role in the 2020 pandemic. During the spread of COVID, public health officials collected data from healthcare organizations for case reporting. Case reporting was an essential part of patient care during the pandemic as it allowed officials to monitor the trends of the virus over time, as well as inform organizations on the best practices in addressing the pandemic. So, HIM professionals were responsible for tracking this data to report to public health officials, and these professionals were a key element in being able to control the spread of the COVID-19 virus. And the data collected included patients who may have tested positive for COVID-19 and the total number of deaths due to COVID. So case reporting has allowed health officials to better understand the potential effects and outcomes of COVID-19. Data collection during the pandemic. The data collection during the pandemic was crucial in understanding the impacts of COVID-19. HIM professionals collected data throughout the pandemic to further analyze and monitor trends associated with COVID-19. Data collection was essential for factors such as contact tracing, early identification, treatments and recovery, case reporting, and risk factors. The number of positive COVID cases in West Virginia from 2020 to 2022. To the right, I have included a visual of the number of positive COVID cases over time in West Virginia. As you can see, in December 2021, there was a spike in the number of positive cases, and by June 2022, the number has significantly decreased. And I would say this is due to our advancing technology and just the number of resources that we have available to us, such as immunizations, telemedicine, case reporting, and electronic health records. So, data tools and resources used during COVID-19. The use of electronic health records increased dramatically during the pandemic of COVID-19. EHRs are used to electronically store patient information that is maintained by a provider. And this information can include key administrative clinical data such as patient demographics, progress notes, nurses' notes, medications, lab reports, radiology reports, diagnosis, treatments, immunizations, and vital signs. Data tools and resources continued. So, the increased use of EHRs has allowed telehealth to evolve and become a mainstream option for providers as well as their patients. Telehealth is the use of electronic information and technologies to support clinical care through an online patient portal rather than scheduling in person office visits. Some of the benefits to using telehealth include virtual patient visits, fewer hospital admissions by 38%, it's cost effective, um, available health care for those who may be limited access to care, reduced wait times, reduced time spent on treatments, minimizes the spread of infectious diseases, access to patient portal, and improved patient outcomes. Patient portal has become one of the most effective resources used within healthcare. With the implementation of patient portals, providers are able to communicate with their patients without having to schedule an in-person office visit. Um, with this, patients are able to quickly access their health records and see their test results, treatments, current medications, schedule appointments, and even request prescription refills. With the use of patient portals, healthcare providers are able to optimize workflow and improve clinical outcomes. EHRs and telehealth were two of the most essential resources used by healthcare providers throughout the pandemic. Implementation since the COVID-19 pandemic. The healthcare industry has made many changes since the COVID-19 outbreak. There has been a great number of new implementations to ensure that we are still providing the best quality care possible for our patients while following COVID-19 guidelines. Some of the new policies and procedures within healthcare since the pandemic include wearing protective gear when treating any patient that has been exposed to the virus. PPE gear consists of a mask, gloves, gown, and goggles to protect providers against the spread of the virus. All positive cases are to be reported for case monitoring. Only one family member is allowed within the patient's room during scheduled visiting hours. Social distancing from patients who may have tested positive. Patients must quarantine for at least 5 days after testing positive. The implementation of the new vaccines to treat COVID, Pfizer, Moderna, and Johnson & Johnson, and the Families First Coronavirus Response Act, which provided a temporary 6.2 increase to regular federal medical assistance percentage rates. So, a little bit more about the Families First Coronavirus Response Act. This was put in place to provide financial assistance to those who had been affected by the pandemic. Um, it requires specific employers to provide staff members with paid sick leave or to expand family and medical leave for specified reasons in relation to COVID 19. So this was effective from April 2nd, 2020 to December 31st, 2020. The impact of pandemic on traditional HIM workflow. There have been many gaps and challenges associated with the pandemic. When the spread of the virus first appeared, healthcare professionals were left with many unanswered questions and fear for the future. We were unsure how long this pandemic would last and the impact that it would have on the healthcare industry. Healthcare professionals were faced with many challenges, such as working tirelessly to care for patients who had been in contact with COVID 19. Frontline healthcare professionals were exposed. Frontline healthcare professionals were particularly vulnerable during this time as they had a commitment to contain and control the spread of the virus. Social distancing was also put in place. Um, it was said to be the most effective method to limiting the spread of the virus, although this was difficult to implement for healthcare workers who were caring for infected patients, just coming in direct contact with the disease and essentially putting them at higher risk for becoming infected themselves. And there was a limited number of protective supplies to treat these patients. So there was a limited number of supplies to be able to properly care for patients who did test positive, and there were a shortage of masks, hand gloves, and personal protective equipment to protect providers from becoming infected when treating COVID positive patients. So I have also included an informational clip regarding the impacts of COVID-19 on healthcare, specifically long-term care facilities.
While the coronavirus has significantly changed our everyday lives, it also revealed gaps in our healthcare system that need to be filled. One big area of concern for many experts is long term care homes, which have seen devastating outcomes during the COVID-19 pandemic.
That's really a wake-up call that we need to do much better for those for people in chronic homes. We would have benefited from earlier intervention to have people who have training in infection control to go in there and say an outbreak is starting.
Banerjee suggests in the event of future outbreaks, long-term care homes could really benefit from a team of experts going in and separating the healthy people from the sick, splitting up all residents who share a room, and do rapid testing to identify residents at risk. Along with changes to patient management, We can also expect to see changes made with how staff are managed. Things like the number of staff assigned to a resident, infection control training, and reassessing whether they should be allowed to work with more than one patient and rotate between homes.
There has been some concern with the fact that care providers may work in more than one home, and so they are potential vectors, if you want to think of it about that, of transmitting the disease from one home to another.
Many countries also faced a shortage of personal protective equipment such as masks, gowns, and gloves for their healthcare workers.
Something that's been very stressful to myself and many of my colleagues, well, all of my colleagues, anyone who's doing frontline work, who's being exposed to coronavirus on a regular basis, a lot of them were not feeling protected.
Banerjee says we can't stockpile PPE for the next outbreak because this type of equipment doesn't have a long shelf life. But what we can do is produce PPE locally.
We've really seen that we're quite vulnerable if we're depending on other countries to provide us with masks and other sort of things. So I think you'll see a renewed call for domestic manufacture, domestic supply.
With the pandemic pushing healthcare systems to the limit, experts feel a lack of staffing added to the problem.
It may be that we just really have to think about, do we establish a volunteer corps, can be called on during these times that we really need a lot of boots on the ground.
Jane says this is also an opportunity to create more jobs in the public health sector going forward.
Public health is not the sexy part of medicine, right? It's not where you're being rescued or saved from dying. It's really, if public health is successful, nothing happens. And it's hard to get people to fund nothing happening. But that's really what we want to happen, right? We don't want to have these pandemics.
Many countries also found themselves running low on supply for testing kits, so they had to prioritize who they tested for COVID-19. And because of this shortage, many people had to be turned down for testing and were asked to self-isolate.
We were just totally blindsided and not prepared. I think we have to look at the infrastructure itself. Number one, we didn't have the infrastructure to produce test kits in a timely fashion. We didn't have a good surveillance system. And part of the surveillance system really requires accurate tests. We didn't have that ready.
A shift that's likely to stay will be how we interact with healthcare professionals. Telemedicine was used effectively that helped healthcare workers screen people over the phone for COVID-19 so they could avoid patients from going into clinics and ERs and spreading the virus.
I think we are going to be applying telemedicine to deal with other types of health issues. And I think that's going to make it more efficient.
The COVID-19 pandemic shed light on many deficiencies in our healthcare systems around the world. But experts feel that the negative experiences we faced will be the seeds for positive change in the future. Thanks for watching Global News. If you want to
So I actually found this video very interesting as I completed my supervised student hours at Sundale Nursing Home this semester, which is a long-term care facility. And when I first started, they had just recently stopped testing all staff members for COVID. And I know that they had an entire separate unit for COVID positive patients. And I just think this was a really important factor in being able to limit the spread of the virus within their facility. Physical and mental effects of the pandemic on HIM professionals. Along with the challenges HIM professionals faced within the healthcare facility, these professionals were also faced with personal issues at home. Many healthcare workers suffered from insomnia, loneliness, sleep disorder, and a mental depression as a result from the overbearing workload and related stress. Throughout the first few months of the pandemic, studies have shown stress levels significantly increased within healthcare workers due to the uncertainty of the future and the impact that this pandemic would have on our healthcare industry as a whole. Workers experienced burnout and exhaustion due to the overbearing workload, treating COVID positive patients, and a shortage of staff members as well as protective equipment. In the early stages of the virus, We did not have an established vaccine yet, so healthcare workers were left with no answers and just confusion on where to go from here. And there was a limited amount of testing supplies as well available for patients, so providers had to pick and choose which patients could be tested. Workers were expected to work long hours, which just increased their risk for becoming COVID positive. Even after the pandemic, many of the effects the pandemic has had on the healthcare workforce will still likely persist. How healthcare has evolved since the pandemic. In 2020, the COVID pandemic impacted not only HIM professionals, but the healthcare industry as a whole. It led to disruption to both the global economy and healthcare. COVID 19 created many challenges for HIM professionals, but has also opened up a door for new opportunities. Since the pandemic, there have been many changes within the healthcare system. We have gained support for new resources and technologies to help us better understand the virus and how it has affected the patient population. With the implementation of EHRs, telemedicine, artificial intelligence, and health information exchange, we are able to study and analyze trends that are associated with COVID 19 and prepare solutions. The new resources offered have enhanced the connection between patients and physicians by allowing for virtual communication, education, and even scheduled appointments. The healthcare industry has continued to evolve since the pandemic and finding new ways to improve patient satisfaction through quality care. The pandemic of COVID 19 came with great challenges but has essentially allowed healthcare to evolve by finding new and improved ways of providing our patients with the best quality care. I've included some proposed questions. The first one being, how has COVID affected you personally? So, throughout the first wave of COVID, I actually did test positive, and this was just a very scary time for me as I was away at school and I had to manage taking care of myself without spreading the virus to the roommates I was living with at the time. And this was before we even had an established vaccine available. And my mom is actually a registered nurse at Frederick Memorial Hospital, so she gets to experience COVID firsthand when treating for her patients. The second question, how do you think the pandemic has shaped the future of our healthcare industry? So I think that there were many challenges associated with COVID 19, but it has essentially allowed us to address the gaps within our healthcare system. We now have access to advancing technologies that have helped us control the virus and introduce new resources to enhance the quality of patient care. The last question, how can we prevent an incident like this from happening again? I think the best method for working to prevent another global pandemic would be to remain up to date with our advancing technologies and just ensure that our healthcare workers continue building their education through experience and training. And then I have just included my sources here at the end.